Hi, my name is Kyle Chang. I've been a dialysis patient since 2013, and for most of it, I've done peritoneal dialysis or PD. So today, what I want to talk about is what do the different solution strengths mean when you're doing peritoneal dialysis. Stay tuned. Okay, for all you peritoneal dialysis patients or folks thinking about doing peritoneal dialysis, there are different strengths of the dextrose solution that you can use during peritoneal dialysis. And they produce different UF results. UF means ultrafiltration, and that is the excess fluid above your fill volume that's taken out. And there's a different video that talks more about the ideal UF or total UF that you should be getting because it's a little bit different for everybody. But today, let's talk about the different solution strengths. When you get your shipment of solutions or the first shipment, often there are different color cases that are part of the solution strength. And your training at the clinic should also help explain this in detail as well. If not, definitely ask your peritoneal dialysis nurse, PD nurse, at the clinic. Typically, there are 3 different strengths that you would use. It is the yellow, green, and red. The yellow is the lowest strength solution at 1.5% or 1.25% in some of the other countries outside of the United States. The green is a 2.5% dextrose solution strength or 2.50 in some other countries. The 4.25%, which is the red, is the strongest. And sometimes other countries, it may be a 4.25, 4.5. There are some variations between countries. Dextrose is a sugar-based solution. The higher that solution strength is, the more fluids and toxins is going to draw out of your system. For the most part, the toxin level of removal is more based on your fill volume and dwell time, so it's not as much of a concern. However, if you have a higher dextrose solution strength that you're using for your treatment that day, the higher the solution strength, higher percentage will usually yield the more excess fluids that's being withdrawn from your system through the peritoneal cavity. 4.25 again is the highest, 2.5 green is the medium, and then 1.5 is the lowest strength. Everybody has different prescription strength based on your peritoneal equilibrium test, or what we call the PET test. And that's usually done within the first month or so of your peritoneal dialysis treatments, or sometimes during the training at your PD clinic, so that they can assess how long and how fast you extract fluids from your system through your peritoneal cavity. For me, I am a high average transporter, so 2.5 greens is what I typically use all the way through the 5.5 years on peritoneal dialysis, and that works for me, and then gives me an average about 1,200 to 1,500 milliliters of total UF during my treatment on the cycler. Again, those numbers are not as important. It varies on the individual, and it depends on your fill volume, the amount of time you're dwelling on each exchange, and then how many exchanges you have during your treatments. And that 1,200 to 1,500 for me is based on using the cycler at night, 8.5 hours over 6 different exchanges. That's what works for me. That's what comes out average that I've noticed after several months using peritoneal dialysis on the cycler. On the UFs, on individual exchanges, if I do manuals, I may only get 200 milliliters extra excess fluids for me. Some of the other variables also is contingent on how many exchanges and then also how much fluids that you consume during the day. So if you consume more fluids and then you're using a higher solution strength, that will extract out more excess fluids and generate a higher total UF or a higher UF. So those are some of the things that you want to be aware of in terms of the different solution strengths and dextrose. Now, depending on the type of fluids you're consuming, I usually just drink plain water, and that typically comes out and processes out quicker. If you're drinking warm water, it takes a little bit longer to process out. If you are consuming a lot of sodium in your diet, that typically retains more of the fluids that you consume during the day, so it may not process out during the same day. It may process out the next day. If you're consuming sodas or juices, that tends to stay in your system longer. And of course, for if you have issues with phosphorus, sodas, especially dark sodas, may not be ideal for you to drink due to the higher phosphorus items. And then if you have high potassium issues, some of the fruit juices may not be ideal for you. And of course, both sodas and juices are high in sugar content. Sugars tend to be inflammatory in your system, make you more prone to infections and whatnot, or acne and cysts. So I tend to avoid those myself. You can decide what's appropriate for you based on your own labs and also what works or doesn't work for you, your medical history, and your diet. Definitely check with your renal dietitian if you have any questions about that, and also about what to drink, what not to drink, and different diets. So take consider of your labs, your own medical history in terms of what you consume or not consume. So again, 3 different dextrose solutions: 1.5 yellow, 2.5 green, 4.5 red is typically the different solution strengths that most peritoneal dialysis patients will use. Some folks, either diabetic or if they have long dwells during the day on PD, they may be prescribed an icodextrin or extraneous solution that's made only by Baxter. That is a 7.5% solution. However, it does not necessarily work stronger in terms of removing fluids compared to the red, because this is actually cornstarch based. The icodextrin extraneous is cornstarch based as opposed to dextrose, so it works a little bit different. It is designed for long dwells, 8 to 16 hours during the day, or some folks are prescribed to use that overnight if they do manuals. Also, it helps some of the folks to control their blood sugar levels while on PD. For example, if you're a diabetic, some diabetics may be beneficial to actually use icodextrin or extraneous solution. So that's something to talk to your nephrologist about in your particular situation. So I did want to mention that because some folks get that confused with the other 3 solutions. Hopefully this helps you. If it does, give me a thumbs up on this video and do share it with other folks that you do enjoy it with. Make any comments below in terms of different things you learn or things that help you or other folks in terms of the dextrose solution strength. Hopefully this helps you, and look forward to other videos in regards to the difference between UF and total UF. If it's the first time that you're on this channel with me, do subscribe. Thanks for joining me today at Kidney Journeys. Do your dialysis treatments so you can do things you enjoy with the folks you enjoy it with. My name's Kyle Chang.